Welcome to Hit Show, your go-to source for today's leading healthcare business headlines. I'm your host, Rhonda Brooks. It's Monday, August 25th, and today we're looking at new cardiac innovations in New Jersey, stricter oversight of hospital sales in Rhode Island, and a rural hospital closure in California. Later in the program, we'll turn to Oracle's market share troubles, new funding for Twin Health, and the latest consumer health tech news from Google and Apple. We'll begin with a story from New Jersey, where hospitals and medtech firms are teaming up on cardiac care innovation. Teresa Vaughn is covering this one.
That's right, Rhonda. RWJBarnabas Health has joined forces with Cytec City in Jersey City to pilot an impressive slate of cardiac technologies. Among them, BioBeats FDA-approved cuffless blood pressure patch designed for 24-hour monitoring, BD's Hemosphere Alta AI platform, which uses predictive analytics to anticipate blood flow problems before they occur, and devices from Rhythmetics and Avertix that enable continuous remote monitoring and early detection of cardiac events. What makes this significant is the equity angle. These pilots are structured to reach underserved populations by lowering barriers to access. The project is being touted as a model for how public-private partnerships can close gaps in heart health.
These are very advanced tools, Teresa. Do leaders see this as something that can move from pilot to practice pretty quickly?
They do. Hospital officials told me the technologies are scalable and could be deployed broadly across both inpatient and outpatient settings. The hope is to prove not only clinical benefit but also economic value, which would accelerate adoption.
Important work with real potential impact. Thanks, Teresa. Now to Rhode Island, where the Attorney General has taken a hard line on a hospital sale. Anika Shah has the story.
Rhonda, Rhode Island just approved amendments to the sale of Roger Williams Medical Center and Our Lady of Fatima Hospital. And the deal comes with some of the strictest conditions we've seen. It requires $50 million in capital investments over 3 years, gives the state enhanced monitoring powers, even the ability to appoint receivers if financial risks arise, and mandates ongoing reporting. The action follows years of financial strain under Prospect Medical Holdings, the prior owner, which drew criticism for private equity mismanagement. Advocates say this new framework could become a national example for how regulators handle hospital sales tied to investment groups.
A notable step in the broader debate over private equity's role in healthcare. Thank you, Anika. And in California, one rural community is bracing for the loss of its only hospital. Peter Betterworth reports.
Glenn Medical Center in Willows, California, will close after CMS revoked its critical access hospital status. The decision cited regulatory non-compliance and patient safety issues. For a small community, the closure is devastating. Patients will now face lengthy travel times for emergencies and hospital-based services. Leaders warn that closures like this may become more common as rural hospitals struggle with compliance costs, staffing shortages, and reimbursement pressures.
A troubling development for rural care access. And this story leads directly into our break. When we return, Oracle's uphill battle against Epic. Hit Show is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care, their way. The journey toward the summit of healthcare has begun, and through partnerships built on trust, Sunrise is helping healthcare organizations bring next-level care within reach. You're listening to Hit Show. Now to a major shakeup in the electronic health record market, Logan Stokes has more.
Oracle Health has lost 57 unique acute care customers, including 12 major health systems, since its 2022 acquisition of Cerner. Meanwhile, Epic has climbed to more than 42% of the market, compared with Oracle's 23%. Customer satisfaction with Oracle has dropped from 67% in mid-2022 to 47% this year, though some health systems are cautiously optimistic about Oracle's new AI-driven tools like the Clinical AI Agent and its updated ambulatory EHR.
Logan, this is a big shift. What does it mean for the industry?
It's huge. Epic's growing dominance could make it the de facto standard, raising both integration opportunities and concerns about vendor lock-in. For Oracle, it underscores the challenge of integrating Cerner while convincing systems that its AI roadmap is worth betting on.
That's a sharp reminder that health IT isn't just about the technology, it's about trust. When confidence erodes, even giants like Oracle can see hospitals walk away, and Epic is seizing that moment. This could be an inflection point that will shape the digital backbone of U.S. healthcare for the next decade. Nate Collier now brings us a funding story in the metabolic health space. Nate.
Digital twin startup Twin Health has raised $53 million, putting its valuation just shy of $1 billion. For those who may be unfamiliar, a digital twin is a personalized, data-driven virtual model of a patient's body and health status. By running simulations, clinicians can predict how a patient will respond to interventions. Twin Health applies this to metabolic disease, particularly diabetes, tailoring recommendations for lifestyle, medication, and diet. The new funding will support expanded partnerships with providers and employers, plus more clinical validation.
That's a powerful application of AI personalized care at scale. Thanks, Nate. We're finishing today with some consumer tech news that's hitting both sides of the smartwatch world. Jade Romero is following it. Jade, I hear there's good news and some not so good news.
That's right, Rhonda. Let's start with the good news. Google is rolling out a Gemini-powered personal health coach for Fitbit this October. It's a single platform that combines fitness training, sleep coaching, and wellness advising. It'll be part of Fitbit Premium and will work across the new trackers, Pixel watches, and Fitbit smartwatches.
So more like a whole health advisor on your wrist?
Exactly. Google says the AI will deliver real-time, personalized guidance, so it could recommend recovery days after poor sleep, or tailor a workout plan based on your stress levels. It's designed to feel less like a gadget and more like a coach.
That's a big leap for consumer health wearables. But you mentioned a tougher headline too?
Yes, the ongoing legal fight between Masimo and Apple. Masimo is suing U.S. Customs for allowing Apple to re-enable blood oxygen monitoring on certain Apple Watch models. They argue Apple's workaround still infringes on Masimo's sensor patents, despite an earlier ITC import ban.
So Google is adding more features, while Apple is still fighting to keep one of its health features alive?
That's the contrast. For consumers, it means more innovation, but also uncertainty, especially if another ruling limits which Apple Watches can include medical-grade functions. For the industry, it underscores how high the stakes have become in the battle to control the wrist as the gateway to health data.
So a win for Fitbit users, but another round of uncertainty for Apple owners, and a reminder that the future of wearable health tech will be decided as much in the courts as in Silicon Valley. Thanks, Jade. That's all the time we have for today. Thank you for joining us on Hit Show. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on hit.show. Hit Show, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. Hit Show is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, kimchi.com.